Gratitude program is a program that has been at Pine Grove for a little bit over 10 years. It was founded by Patrick Carnes, who was one of the leaders in developing the field of sex addiction. We work primarily with people with sex addiction. Many of them also have other addictions such as alcohol, drugs, gambling, or food. And we combine those because they do overlap. Gratitude also treats co-occurring disorders. We have a strong overlap with post-traumatic stress disorder, anxiety, and depressive disorders, as well as the other addictions. Our basis is a 12-step model. We hope that in the 45 to 60 days that people are there, they will work through the first 3 steps and be prepared to go back into their real life and into their recovery program and keep working from there. Part of the foundation of the treatment at Gratitude comes from Dr. Carnes' 30-task model, which is basically a breakdown of tasks that help support the 12 steps and help support the family healing. The family's role in recovery at Pine Grove is essential. In addition to the fact that the majority of people come in because there's been a crisis in the family. We encourage all of our spouses to get into their own therapy because we do know that particularly with sex addiction, the consequences, the realities, and sometimes the crisis that brings the addict to treatment are traumatic and they're difficult and they change the whole life of the family. The Gratitude program relies very heavily on the community 12-step recovery program. They go out to meetings about half the time. We do have meetings every day. The integration of the programs at Pine Grove, I think, is somewhat unique in that while we are all autonomous, we all work with each other. We will very frequently receive a patient from one of the other programs. For instance, somebody who comes in chemically dependent, needing detox and stabilization there, will spend a period of time at Next Step or the women's program and then come to us. One of the nicest things about working with Pine Grove is that every now and then we have somebody who psychiatrically needs a higher level of care. And we're connected. It is a simple phone call and transportation ride to stability and safety and protection, which is such an asset at the residential level of care. We see folks who are often deeply wounded, deeply grieved from childhood and throughout their life, and at the same time extremely successful, extremely on the surface having everything they could want and desire, but yet caving in and hurting and needing to resolve issues that are very complex. With the integrated staff that we have and the capacities that we have to treat in an environment that is supportive, I think it's a unique combination of things that I've not put together in other programs I've worked with. A typical participant in the program will not only have completed some of the paperwork and the group work that goes along with the first 3 steps, but we'll have a concept of surrender and acceptance and the notion that they are not alone. And not only is there a community, but there is a power greater than themselves.